Hello everyone and welcome to Healthcare Education. Today we will talk about imaging, or more specifically about medical imaging, which creates so-called sonograms. We are going to look at how it works, what are the principles of function like piezoelectricity effect and Doppler effect, and for all who had already an examination by use of ultrasound, we have the question, what's the reason for using the mostly cool gel during the examination? So let's begin. Let me introduce you to this wonderful medical device. The technology was first used in the military for the detection of submarines and later used for the investigation of materials. Today its most common use is obviously in hospitals for clinical diagnostics. Below we have plugs which belong to the later more explained ultrasound transducer. A common ultrasound unit consists basically of a monitor to see what we examine and a high performance computer unit. We also have a power cable with power supply and an Ethernet cable which can transfer data via network adapter to systems like HIS. That's the Hospital Information System, or also to the PACS, that's the abbreviation for Picture Archiving and Communication System. So, how do we simplify the function of ultrasound? The images which we can inspect get generated by the integrated high-performance computer, that's clear, right? But before this, we should talk about the transducer, which has at least the same importance. That element uses the so-called piezoelectricity effect to send and receive mechanical sound waves. As this procedure spreads the waves within our body and they get reflected, or you could also say that echoes appear at points where especially the tissue density differs. For example, at the transition from fat to muscle tissue. Yes, not every wave gets reflected. Some break through the changes in tissue. That means that every wave which comes back to the transducer has a different term, or you could also say running time, and it exists in the following relation. The higher the density of tissue, some say also acoustic impedance, to density of tissue, the higher the reflection, okay? The higher the density of tissue, the higher the reflection. And yes, on this basis of the running times, here in this graph, gets images created, okay? Images, right? Not quite. We speak about ultrasound, that means we speak about sonograms. In addition, there are further relations of parameters, which are depending on each other. Factors like the resolution, shown at the right vertical axis, the ultrasound frequency, which we can see at the horizontal axis, and another parameter is the depth of penetration, shown at the left vertical axis. By the way, that shouldn't be an exact graph, okay, but more an orientation to imagine. So, as we can see, the resolution depends on the depth of penetration, and we are able to influence that result by changing the frequency. Consequently, we have different frequencies and transducers for different applications. For example, in order to image organs like heart, liver, and kidneys, the frequency range is from 2 until 3.5 MHz, with a depth of penetration between 15 and 25 centimeters. Another example is the frequency between 7.5 until 15 MHz, with a depth of penetration between 2 until 7 centimeters, where we usually examine organs such as breath. So guys, in order to understand everything what is important in relation to the function, we need to focus on two terms in more detail. Firstly, the piezoelectricity effect, and secondly, the Doppler effect. The piezoelectricity effect is a long word, yes. That means for the rest of the video I will use the abbreviation piezo effect, and that takes place using specialized crystals within the transducers. And the transducer can have three different shapes. At first, there are sector transducers. Secondly, there are linear transducers. And lastly, but not least, we have convex transducers. Which of them we use depends on the region we examine. The piezo effect exists in two types, which are both necessary for creating images via ultrasound: the inverse piezo effect and the piezo effect. Let's start with the inverse piezo effect. So if we take this crystal and apply a potential, to be exact a DC voltage, the crystal starts to deform, and due to this process sound waves, in our case ultrasound waves, are created. For the other type of piezo effect, we can use a simple molecular structure. In reality it's bigger, but this is enough to show an example. So we have a little molecular grid with a neutral charge point inside, okay? Then if we say that sound waves bounce against the crystal structure, the impacts cause deformation. Then based on these events, the point in the middle, the neutral charging point, is going to shift to another position, clear, yes? That leads to a voltage change, which in turn can be measured or used for imaging. Next we must talk about the Doppler effect. The Doppler effect is an old German bad strategy that you can use if you play roulette in a casino. Just a joke, I'm sorry, definitely not. What exactly is it? It is, you can call it also as frequency shift. For example, almost everyone knows this phenomenon when we stand near the street and an ambulance drives past and we hear the siren. What is the siren doing? Of course, it's sending sound waves, which we can hear, but the sound waves are not the same as if the ambulance was parked with the sirens on. When parked, the sound waves are all straight in the same way, to the left, to the right, and up and down. But when the ambulance is driving, however, there are differences. Here, at first, we need to clarify the parameters like frequency and wavelength are always in opposition to each other. The formula is the speed of light is equal to wavelength times frequency. And in addition, we know that this coherence is only valid for electromagnetic waves, but we can, in this case, we can also use it to illustrate and explain the Doppler effect. So now, when the ambulance drives past and we have a pedestrian, for example, who hopefully is not standing on the road but the pavement, as the ambulance drives in direction to the pedestrian will hear higher frequencies. Oh, how we all love that sound, yes? And then if we assume there is another person, for example in a car, in a cabriolet here, in this case, and the cabriolet is going in the opposite direction to the ambulance, then the driver of the car would hear deep frequencies with, of course, higher wavelengths. Should be clear, right? The ambulance changes the speed of the sound waves as it moves. Then the frequencies also change the wavelengths in front and behind the ambulance. And that is all in relation to anyone who is able to hear that sound. So there are different applications which are based on the method of frequency shift. One is the continuous wave Doppler. Here we have two crystals. One of them exists for sending and the other for receiving. So in a bloodstream, as shown, we have corpuscles. You surely know this red or white corpuscles in your blood. If we send an ultrasound signal to the bloodstream, we get the signal back like a reflection. In this method, there is a continuous sending and receiving resulting in a high spectrum, or in other words, a high flow speed of corpuscles. By the way, this method, however, makes it harder to classify. The pulse wave Doppler makes classification easier. During this technique, we have just one crystal, but in addition, we have a sort of gate, which helps us to match or allocate the depth in the bloodstream and the corpuscles. This is a benefit in comparison to the explained continuous wave Doppler, but the disadvantage is then the limited flow speed, okay? Anyway, so if we look at the bloodstream, the gate enables us to measure and examine something in a defined point and depth. How are we able to do this? With the knowledge of speed of the wave and the medium. Then we should get the duration. So the crystal sends one wave and waits until the wave comes back from a defined depth. That's all actually. The main benefit over the previous technique is the accuracy, but the disadvantage is the mentioned limited flow speed. The color flow Doppler. This application enables the illustration of color-coded information in relation to the different flow directions. Generally, the red pixels will represent a flow direction to the transducer, and the blue pixels a flow direction away from the transducer. So finally, let's try out the device, and since we are not a physician, let's hope we can recognize something. For what reason do we actually need that gel between transducer and skin surface? Well, our bodies consist of about 80% water. That means our fat, muscles and brain contain a lot of water. So for this reason, the device is adjusted to a sound speed of 1500 meters per second, which is exactly suitable for the mentioned things. Only bones and air have absolutely different acoustic impedances and would scatter or reflect the sound waves, almost to total reflection. That is why we can take the watery gel to bridge the air. So we can see the transducer stands top down on my arm, and if we look at the screen, then we see also from the top to bottom. Basically, at first the skin, then the muscles or fat, and further below bone. What do we... Oh, I'm not sure if everyone could, but a physician could recognize. Here is a knob under my skin that's a tumor. Well, let's keep calm and relax. A tumor is not always a bad, fast-growing growth. It could also be benign, means not harmful. For example, in this case, it's a so-called lipoma, which is slightly movable, so I can push it in different directions. It consists of fat, grows slowly, and is most likely benign. So that should be enough of explanation. I hope I could help you. Thank you very much for your attention, and see you soon.